all of us have a role in keeping Medicare strong. Providing access to quality health care is a critically important part of our commitment to seniors. But we also recognize there are other key steps we can take to improve their lives and improve the lives of their families and their caregivers. Today, approximately 10 million Americans need long-term care services and supports, and that number is rising steadily. By 2020, we expect that 15 million Americans will need some kind of long-term care. But for too long, we have had citizens faced with what is almost an impossible choice: living in a nursing home away from their loved ones, or living at home without the services and supports that they need. I know that many family members are caregivers and delivering that very important care and support, but often they also lack sometimes the skills, sometimes the support that they need, and they get burned out and run out and timed out on their caregiving abilities. So our philosophy has been to build a network to give seniors better choices. Over the last 3 years, this administration has made an ambitious commitment to make sure seniors have the support and services they need to live as independently as possible in their own homes and in their own home communities. We've extended and enhanced a program called Money Follows the Person, which helps persons with disabilities transition from institutional to community settings. We have 43 states in the District of Columbia already participating in that program, and nearly 20,000 people have transitioned out of institutions with the support. And now the health care law is adding 5 more years and $2.25 billion to expand on that success. The law also gives states the option of establishing a new Medicaid category for people who received home and community-based services, even if they don't meet the requirements for nursing home care. It's really to help prevent people from having to make that ultimate choice. So the law creates a new flexibility designed to tailor services to meet people's needs in their own communities. And at the same time, we continue to provide grants to invest in a wide range of supports to help family and informal caregivers care for their loved ones, with training, with individual counseling, and with respite care. Last month, we awarded $300,000 in health literacy grants to NHCCOA to train and deploy promotores in community-based settings where they will teach older Hispanic adults with chronic diseases, as well as their caregivers and families. This model has been incredibly successful and incredibly supportive. So with all of those steps, it's really one of the strongest commitments we've ever seen across the federal government to a community-first approach to long-term care. We recognize that this work builds on a foundation laid over many years by leaders like those of you in the room. For 40 years, NHCCOA has been a very strong voice for Hispanic older adults. And when the national conversation has turned to programs like Medicare and Medicaid, we've looked to you to help remind communities what's at stake. And today, as Dr. Cruz has said so eloquently, those stakes are higher than ever. As you know, the Republican budget in the Congress have their own plans for Medicare and Medicaid. They passed a budget that would turn Medicaid into a block grant program, which means that no guaranteed benefits for any population, and slash its funds by $750 billion over the next 10 years. $750 billion. That's almost a third of the funding for Medicaid would be gone. And their proposal ends Medicare as we know it by changing from the guaranteed benefits that we currently have into a voucher program and turning seniors over to navigate and negotiate with insurance companies. You are right. So the fact is right now that we have 50 million Americans counting on Medicare, and 2/3 of Medicaid spending goes to 2 populations: care for older Americans and care for persons with disabilities. So you can't cut 1/3 of those program dollars without harming older Americans in nursing homes and at community levels, and persons with disabilities. But we can't afford to take these programs for granted. Seniors have given a lifetime of hard work and sacrifice to their country, to their community, to their families. They deserve the basic dignity that comes with quality care and the support to live at home and in their own communities, and we all need to work to make that happen. Over many decades, our nation has built programs like Medicare and Medicaid that fulfill that fundamental promise. And we've worked hand in hand with our partners to protect and improve them. So I'm here to say we are eager to continue to work and partner with all of you. By working together, we can continue to honor this commitment, not only for this generation, but for generations to come. Thank you for what you do each and every day, and have a great conference.